1, 2, 3, 4,
5.
Imagine living in a world where one has to decide between death or a lifetime of financial struggles. Sadly, this is the reality for many Oklahomans. I have the privilege of working at a community health organization in the state, and I see this every day. I see patients refusing to go to the ER because they can't afford the bill. Luckily, a couple of legislators from our state are trying to pass a bill to lower healthcare costs. Today we're going to talk about why you should support Oklahoma House Bill 2400. We're going to talk about what this bill proposes to do and how it will benefit our state. But first, let's talk about what this bill plans to do. This bill proposes that all Medicaid and Medicare accepting hospitals be transparent. In other words, they will be required to post 3 things on the Department of Health website. First, they will post cost reports. They will have to post billing information and reports about quality of care. First, they will report the cost of services that they provide. They will provide data regarding the 100 most common surgical procedures and the 50 most common imaging services, such as x-rays and CT scans. They will provide billing information. In other words, how much they are charging for those services. The patient will be able to see how much those services cost to the facility and how much they're being charged for them. They will also have to report annual reimbursements from Medicaid and Medicare and how the patients are required to pay, whether it is in full, in payments, or by using a third party. And finally, they'll have to provide reports on quality of care. If they violate this bill, they risk losing their license, they risk losing Medicaid and Medicare reimbursement. We talked about what this bill will do, but let's talk about how this benefits us as a state. Both parties will benefit from this bill. First of all, healthcare will decrease. In a 2014 report titled Health Price Transparency, Policy Approaches and Estimated Impact on Spending, written by Dr. White, Giesberg, Tu, Richovsky, Smith, and Liao, they state that if Medicaid and Medicare would regulate healthcare costs, this would diminish government spending dramatically. In an academic journal written in 2012 by Ameringer titled Chronic Diseases and Increased Prices of U.S. Health Costs, he says that healthcare costs continue to climb every day. But he says that healthcare costs will decrease if patients are well informed about the prices of the treatments and the care they're receiving. He also makes the case that medical tests and services are being overutilized. Physicians are paid by a service, by their services, by how many services they're providing. Therefore, the more medical tests they order, the more money they get. Dr. Keith Smith, who is the director of surgical centers in Oklahoma, he was interviewed by News 9, and he states that this bill will help healthcare be a free market. In other words, when a hospital loses patients to a cheaper hospital, the first hospital will be forced to lower their prices to bring back business. In another interview done by Muskogee Phoenix, Dr. Smith says that this bill will eliminate the greedy profit seeker of healthcare, the corporate hospital. He says that this bill will put pressure on hospitals to either lower their prices or justify their high prices. We've talked about how this benefits the patient, but it also benefits the medical organization. First, by posting pricing information, it's free advertising. You would bring more patients to your organization. But also, as stated before, they are required to put quality reports on the website. And this is important for the benefit of the hospital because quality in our healthcare is very limited right now. Let's actually look at some statistics on infections. These are the 5 most common healthcare associated infections. An example is surgical infections. They cost $3.3 billion to the US. Central line infections, $1.8 billion. Infections by catheters, $27.9 million a year. This is an epidemic. A 2013 academic journal by Aston says that he wrote this article titled "Infection Prevention, Hospitals Step It Up." He says that 1 out of 20 hospitalized patients will contract one of these diseases. And as we see, these infections are not cheap. They will cost you a lot of money. By putting up information like this on the data, on the website, hospital will be motivated to change, to improve their quality of care and improve their clinical outcomes. Today, in conclusion, we've talked about why you should vote for this bill. We've talked about the benefits, and we've talked about what this bill will do. What you can do today is call your legislators, voice your support for this bill. Call the Department of Health. Ask them for pricing information of health organizations in your community. And lastly, before you make a medical decision, do some research. If we all join together, we can help pass this bill so our friends and families will now have to base their medical decisions not on money, but on health.
One, two, three, four,
5.